I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Dr. Breggin? I would like very much to remind the panel that despite the deluge of claims from professionals today about the efficacy of electroshock combined with the horror stories about depression, that as Dr. Hoffman demonstrated, there are but two studies that even deal with the question of efficacy beyond the period when the person is acutely brain damaged. That is, beyond that first month, there will be two studies in the thousand that even deal with the issue of does the patient improve. So there's no real evidence for improvement beyond the organic brain system. I also want to remind you that I challenged a number of the physicians here to produce papers to support their view that suicide is prevented by electroshock. We had that invitation from Dr. Hirschfield again today, Dr. Abrams, and Dr. Weiner. And yesterday, all Dr. Abrams could produce was one more Adrian Winter study, which actually showed no difference between untreated patients and ECT patients in regard to suicide. I would like to offer two challenges. Well, really one challenge. Can Hirschfield, Weiner, or Abrams produce a study that shows that suicide is prevented by ECT? If so, I'd very much like to be able to give it to the panel with comments. And second, Dr. Roth is here. 4 specific questions I'd like you to answer very specifically. You presented your program as one that really dealt with informed consent. First, did you tell the patients that the treatment is controversial, as Dr. Roth demonstrated? Second, did you tell your patients that over half of people who get the treatment, I'll review these with you if you want, so over half the patients who get the treatment feel they have permanent memory loss? Third, did you mention any evidence of brain damage? And fourth, did you describe the frightening experience of the acute organic brain system? So first, perhaps secondly, either of you 3 doctors would like to produce some evidence that electroshock prevents suicide. Give me a paper that I can actually copy down a citation and present it to the panel. I'll get it to you. And second, Dr. Roth can answer this question. Dr. Roth? Dr. Roth.
I think those are good questions, Dr. Breggin. The first point about my research was it was naturalistic research working with the available consent form and within the context of patients receiving clinical treatment. This was not an experimental study in which I embarked upon all aspects of information disclosure that you might deem relevant, some of which I do not deem relevant. I will tell you, so that the first thing that the patients did, of course, was to look at the consent form, and my study was related to their understanding of the consent form. The second portion of the study, in which I informed the patients, I did go into some of these matters, but they're certainly not to your satisfaction. I will say the following things. I did not tell the patients that the treatment was controversial. I happen to believe that the treatment is effective, and it is effective for the patients who the treatment was being administered, and so I did not say that it is controversial. I did say, which is perhaps another way of saying what you're saying, is that the treatment is not always effective. The data that we have, or that we use in our hospital, is that the treatment is 80 to 90% effective. That means that presumably there are some patients who do not recover or are helped, and the patients were told that. With respect to brain damage, I frankly would not tell such a thing to a patient, Dr. Breggin, because I do not believe that there is evidence of brain damage or brain injury on the basis of the scientific literature. I know you feel that that is the case, and obviously that is a matter of controversy.
The issue of controversy that you know about.
Well, I don't want to jump to a conclusion about my answer to that. I'm listening to this. I'm serious. I'm listening to this panel and the variety of information that was presented here, and I think that some decent points have been made about long-term efficacy and other issues which this panel, in its wisdom needs to consider about what is efficacy and what is controversial. Certainly where there's agreed areas of controversy, then I think patients should be told about controversy if there is genuine scientific disagreement about it. The patients are told about memory loss. At the time I was doing this study, which was in the late 1970s, Dr. Squire's studies, which are quite elegant studies, were not available to the extent that they are presently. The patients were told about the period of acute memory loss, that they would not remember the treatment, and that they would have memory deficits around the time of treatment. In fact, that was one of the items that we used to test patients' understanding of the nature of the side effects as to why they would not remember the treatment. However, I did not have available at that time Dr. Squire's studies about anterograde and retrograde memory loss of the spotted kind of type that was presented here. I think that information should be presented to patients, and that is a matter of how science progresses.
Thank you. There is a woman in a brown suit who had this problem.
The doctor's going to produce a suicide study. I've asked them, they're conferring in the back.
There is obviously some differences in interpretation about the suicide study, which you have done a good job, I think, in pointing it out. I think we have to go on.
One shock treatment can equal 150 joules of energy. This is equal to dropping a hammer on someone's head from higher than a 5-story building.
At the FDA hearings, the testimony on the reclassification of electroconvulsive devices cited the literature as whether signed or false, typically about 150 joules of energy in a treatment. With the new Thymatron electroconvulsive device, if you check out at 400 volts, maximum of 0.9 amps, and 320-some millisecond pulses.
Could you finish up your question, your remarks?
Yeah, I would like somebody to tell me. I'm a teacher as well as a physicist, and I brought a kilogram with me. Teachers like to demonstrate. Now, this is a kilogram. It's 2.2 pounds. Heavier than a hammer I used to hit an amp. But I wonder if possibly like Dr. Stein could tell me how high I would have to drop this kilogram from in order to have it hit the ground with 150 joules of energy.
I don't know if that question is in the purview of the panel, but thank you for your report.
Well,
I'd like to go on to the next person.
This is only 10 joules of energy. You're talking about dropping it from higher than a 5-story building. That's physics. Supposedly in pre-med backgrounds.
Thank you.
I never got
All right, out with your gun. Out with your gun.
Okay, this won't hurt. It'll be over in just a moment. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh.
That's right. Just bite down. Now bite down on it.
Good.